Good evening. My name is Angie Pina. I'm the director of the Division of Services for People with Disabilities, and it's 6:30, so we'll go ahead and get started. I just want to first say welcome and thank you for joining us tonight. We have our quarterly meetings so that we have an opportunity to share information with families and self-advocates, as well as to hear from you and have an opportunity to answer any questions. We are working to make these more accessible to those who speak other languages. So if you'd like to try the closed captioning in another language, you can right-click on the closed caption box on the bottom of your screen. It's the CC in a box. Um, a menu will come up, then click on Translate into English, and then you get a box with your choice of languages. And then you would choose your language, and the closed caption will share the information in the language you select. And before we get started, I wanted to make sure you know that this is being recorded, and it will be available Friday on the DSPD website under Individuals and Families tab, and then the Be Informed and Be Involved heading. So also please mute yourselves and type any questions into the chat or raise your hand just to keep it, to try and keep the feedback down. And I'm going to give a minute to Nadia to translate.
Thank you, Angie. Buenas noches. Bienvenidos a nuestra reunión familiar y autodefensa. Esta reunión está siendo grabada, así es que le pedimos que por favor ponga su micrófono en mudo. La grabación la puede encontrar el próximo viernes en nuestra página del internet. Para verla puede ir a dspd.utah.gov, presione en Individuals y Families, luego presione en Family and Self-advocate y puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible por tener esta presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usarlos en español, siga lo siguiente. Presionen el círculo que tiene los 3 puntitos. Presionen la cajita de abajo que tiene las 2 C mayúsculas. Presionen la cajita de la derecha que dice English Caption Settings. Va a salir una caja en medio de la pantalla. Presione la opción Translated Options o Translated Captions y seleccione Spanish. Presione la X en la esquina de arriba a la derecha. Los subtítulos aparecerán en español cuando alguna persona esté hablando. Si tiene alguna pregunta, en la mano derecha, en la parte de abajo, hay un cuadrado con líneas como si fuera que alguien está hablando. Presione y saldrá una pantalla que dice In-Call Messages. Ahí puede poner su pregunta en español y yo le ayudo a traducir. También puede hacer preguntas en voz alta. Puede presionar el círculo que tiene en la manito. Le haremos saber cuándo puede hablar. No se olvide de presionar el micrófono para que la podamos escuchar. Estaré presente y disponible durante toda la presentación en caso que tengan alguna pregunta. Gracias. Back to you, Angie.
Thank you, Nadia. Today, for our agenda, we'll be covering some announcements, including having our new superintendent at USDC introduce himself, other staff changes at DSPD. We have done some surveys and shared those results with you recently, so we'll have someone going over those and sharing that information with you. We also have just legislative updates about where we're at in the session. And we have Medicaid unwinding. I know we shared this with you the last time we met. There have been some updates, so we just want to make sure we continue to share information, make sure you have what you need and have all the updated information. And then we'll have community resources shared with us. We'll have Trish Jones-Parkin with USU sharing customized employment, and then we'll have it open for questions and answers. So we'll go ahead and start through our agenda. We'll just start with having our new superintendent at USDC, Tim Matthews, introduce himself. I'm just going to say we're really excited to welcome him and have him. He started in November, and he comes to us from California, and he came really highly recommended by staff, by state representatives and by his peers. He has many strengths that he's bringing with him that will complement the already great work being done at USDC, and we're just so grateful that he accepted and to have him here. So Tim, the time is yours.
Thank you, Angie. Good evening, everybody. My name is Tim Matthews, as Angie said. Really excited to be here tonight. I'm looking forward to working with everyone and anyone as we work with our families and individuals. I come with a background in community-based services, and so I worked with foster care, adoptions, group homes, and many different individuals over the past 25 years. And so this will be a step over into state work, which has been extremely rewarding already. The team that we have there at USDC and at DSPD are just amazing, and I'm learning so much so quickly. My background is mostly social work, programming, and team building, implementing, and leadership development. And so I feel like I have a good niche here at USDC, and I just really looking forward to meeting any of you and all of you and seeing what we can do together to help everybody in Utah.
Thank you so much, Tim. We also wanted to let you know that we have, we're looking at support coordinator and person-centered planning feedback sessions. So we're going to be starting a series of meetings to discuss the support coordinator's role in the person-centered planning process. And we're going to use this information for a few projects. One of those projects will be to create a survey to assess the planning process from the perspective of the person. We're requesting participation from people receiving services and their families to share their experience working with their support coordinator, preparing for your person-centered support plan meeting, and how services and supports are provided throughout the year. We are currently planning additional dates, but the first dates for the feedback sessions will be virtually and at the USU Salt Lake Center on February 28th, 2023. There will be one session from noon to 1 p.m. and another from 6 p.m. to 7 p.m. And the links to the meetings will be just added to the chat and the notes of this meeting. Also, we have Lisa Wade here to share living the life you choose with us. So Lisa.
Thank you, Angie. Yes, I'm Lisa Wade with the Employment Planning and Community Inclusion team, and we have a great new resource for you. It's called Living the Life You Choose, Preparing for My Person-Centered Planning Meeting, and it's a new resource available to individuals to help them prepare for their Person-Centered Support Plan, or PCSP meeting. Written in workbook format and with settings rule requirements in mind, it explains to each person their choices and rights, what person-centered means, the person-centered planning process, and includes links for several person-centered planning tools. The workbook is a fillable PDF document with embedded links to help navigate from content to the workbook pages. When completed, the person can print or share the workbook pages with their support team at the PCSP meeting. Living the Life You Choose and many other resources can be found on DSPD's Person-Centered Planning webpage, and we'll put a link to that in the chat, as well as a link directly to that workbook so that you can use it as you prepare for your next PCSP meeting. And thanks, Angie, for letting me share that.
Thank you, Lisa. I'm just going to now go over some of our staff changes. So we have a new staff, Laura Ellsworth. She's working with our forensic and civil commitment team as a caseworker specialist. We have times when a person with a disability is civilly committed to our division, and sometimes the complexity of their needs or services requires someone with some expertise in this area. So we're really excited to have her with us and working with that team. Kelly Unger has joined the assessment and support coordination team as a caseworker specialist. Also really excited to have Kelly. That team is who brings people into services, helps them through that transition. So really a crucial role, and we're grateful to have her with us. We have Cheryl Adamson and Austin Aiken. They're both financial managers on our finance team. So while you may not interface with them as much, we know that their role is so critical in making sure we're able to make sure our providers get paid, families when they're doing self-administered services or one-time services on the waiting list. It's really crucial to have every part of our division operating smoothly so that services are successful and uninterrupted. We also have Emily, or I guess I should say Jacinta Ofahangoe. She's a caseworker on our team that supports people to transition from intermediate care facilities. So for people who are interested in moving, that role is also crucial because they help people with that transition and then stick with them for that first year before they transition to a contracted support coordinator to make sure that their services are meeting their needs as they've transitioned. We have Emily Skadorwa. She's our Employment First Program Specialist on our Employment Integration team. They really look at how to help people be integrated, part of the community, work with our contractors, as well as consultants to make sure that we're really providing options and opportunities for people. We also have Rick Burrell. He's our Master Electronic Business Manager. So that means his team supports our case management system. So USteps for our case managers, MySteps that families can access, and then our UPI for our provider system. And then we have Anna Dees replacing, taking a position on our intake and waiting list team. As you guys know, that's really a critical role as well. We have over 4,500 people on our waiting list. We have a small team supporting them. So having people who are really skilled, customer service oriented and resourceful on that team is crucial. So I'm really grateful to let you know about our new team members as we move forward so that anytime you're interacting with people, you hopefully have a little bit of a feel for who they are. Now I'll go ahead and give some time to Tyler Black. He, one of the teams that he supervises is our research team, and they are the ones who have been putting together our surveys and doing this analysis. So I will give some time to him.
Thanks, Angie. Hi, everybody. My name is Tyler Black. I'm an administrator with the Division of Services for People with Disabilities. And I just wanted to first thank everybody. If you've participated in some of our data collection activities in the past, you may have received some emails asking you to complete some surveys. And if you're not receiving those emails, they should be coming from the same account that is sending you updates about these meetings. But if for some reason you're not receiving them, you can send an email to dspdinfo@utah.gov, and we'll make sure that you're added to that list. I also wanted to talk just briefly about our website, where we are housing a lot of these research and evaluations that we're conducting as the result of the surveys that you're completing. And you can go to our website, dspd.utah.gov/research, or go to our DSPD website, and at the top of the screen, there's a menu that's labeled Data and Research. If you go there, you'll see a submenu for research. You'll also see some interactive dashboards and our annual reports under that menu. But if you go to our research page, you will see scroll down to the bottom, and there's a couple of surveys, analyses that we've completed recently that I wanted to just share with you today. The first is our caregiver compensation survey. And this is a new program that was implemented during the public health emergency. And we conducted a survey to evaluate the outcomes of this program, comparing people who received the service with people who did not receive the service. And what we found is that some quality of life indicators, including that caregivers reported that they had more time to spend with their other family members and to complete other responsibilities, household responsibilities, and also they reported greater financial security. If you want to read the detailed analysis. It's on our website that I mentioned. The other survey that I want to talk about that some of you may have participated in is our waiting list outcome survey. And what we're doing with this survey, this is more of a long-term longitudinal study that we're conducting. At this point, we've only gathered the baseline data, but we're looking for changes over time to see the results of the receiving DSPD services, how that impacts quality of life indicators, both for caregivers and for people with disabilities. So for caregivers, we're looking at satisfaction with their quality of life and levels of stress. And for people with disabilities, we're looking at quality of life indicators like community inclusion, being able to go out and participate in their community. So at this point, we've just gathered some baseline data from everybody. We sent the survey out to everybody who's on our waiting list. And over time, as people enter DSPD services, whether they're receiving ongoing DSPD supports or if they're receiving one-time services from DSPD, we'll be looking at how those quality of life indicators change over time. And our hope is that we can use this information to report back to legislators and other decision makers on the value of DSPD programs. So thanks again for the time that you've spent in completing these surveys. And if you see more of them in the future, we just really appreciate you taking the time to answer those questions. And last thing I just wanted to mention is a project. If you're interested in research, and part of what we want to make sure we're doing is reporting back to you, so you're not just filling out a survey and then not seeing any of the results. We want to make sure that you're able to see the results of those surveys. So visit the website that I mentioned and check back in the future, because we are working on a project in the next 6 months or so where we'll be collecting other studies that are being completed across the state of Utah for people with disabilities. And we want our website to be a clearinghouse where you can go and find all of the different analyses and studies that are being completed to just keep everybody informed about disability research issues in Utah. So that's something that we're excited about, and we'll continue to give you updates on that in these future meetings. So that's it for me. Thank you.
Thanks, Tyler. So now we'll just go over some legislative updates about where we are in the session. So our session is in full swing. We're about halfway through, and we've already seen many parents and families advocating at the Utah legislature. So thank you for the time, the effort you put in to make sure that your voices are heard, that your perspectives and needs are heard by our legislators. It really makes a difference for them to hear from families, from people with disabilities who are living this experience. DSPD staff has also had the opportunity to share information in legislative committees for several issues and funding requests that are included in the governor's proposed budget. So last week we presented to the Social Services Appropriations Subcommittee about the needs surrounding several issues. So the ongoing funding requests that we presented to that committee include mandated additional needs in youth aging out, the waiting list, and a nursing rate increase. So mandated additional needs are once someone starts receiving services, if their needs change, whether it's due to their aging, their parents aging, a change in their health, or something else that changes the support needs that they have, we're required by Medicaid to continue to meet those needs. So we request funding from our legislature annually to make sure that we can continue to do that. It can result in whether it's like additional or new services or a higher amount of staffing. And then youth aging out is related to youth when they are with juvenile justice and youth corrections or with the Division of Child and Family Services those agencies are paying the general fund to then get the federal match for the services. And as those youth age and become adults, the responsibility for that general fund becomes the responsibility of DSPD so that we can continue to draw down that federal match. So that's what our first funding request was about. We're also requesting funding for the waiting list to bring in over 200 people. Then we also have the request for the nursing rate increase on the community transitions waiver. So when we were looking at some of the barriers for people moving out of intermediate care facilities, one of the things identified was access to nursing and having sufficient nursing supports. So in that waiver, we included nursing, but what we have been experiencing is that those rates are not sufficient to maintain that nursing contract or those nursing services. And so our intent here is to make sure we're getting what we need in a rate in place that can help us keep that sustainable so that people can remain in the community who are interested in that, or can move into the community who are interested in and have the supports they need for that to succeed. Then we had one-time funding requests that were really related to reallocating funding that we already have. So the first one is caregiver compensation, and this has two parts to it. When we received funding for the spousal caregiver compensation, we received more funding than was used in the end. We have money left from that we're requesting to just be able to reallocate that to use for caregiver compensation for families, for parents and guardians. It wouldn't be everything we need. So the second part of that, what we intend to do is use what is called our non-lapse funding. So if we have funding left at the end of the year, it's not something that's ongoing, but it's something that we can use one time to meet some one-time needs. And our intent is to use that money to make up the difference to be able to use caregiver compensation for at least fiscal year 24. The next thing under the one time is our USDC Behavioral Health Services Unit. The intent there is to contract with a psychologist and psychiatrist to be able to meet some of the needs of people who are entering the developmental center or who already live there. One thing we've seen is a definite trend of people entering with complex needs as well as co-occurring, right? So they'll often have a mental health need along with their developmental or intellectual disability. And we really want to make sure we can get the right supports around them to help them stabilize, help them decompress, and just start to be able to flourish and be able to return to the community, return to their neighborhoods. And the request for that is to be able to do that actually over 3 years. So it would be for fiscal year 24, 25, and 26. So money that we would typically use this fiscal year 23, we're saying we know we have a need, so we'd actually like to be able to use it over this period of time, which is not usual for us, but we have the money and we'd like to be able to use it this way. We also have a request for a reserve account. Again, it would be taking one-time money that we already have and making sure we have a reserve to address, like, if there was an over expenditure due to changing needs or emergencies, so that we could meet that need and still not over expend our resources. It's really more of a safety net. We really strive to stay within our budget, and that is typical to stay within our budget. But as we continue to serve more people and see more crises and emergencies, we want to make sure we're able to have something have a reserve to make sure we're in a good place. And that reserve would represent 2% of our overall budget. And then our last one-time request is around supported living and respite. We know it can be a challenge to access these services, So our plan there is to have one time, like do some grants for our providers to be able to look at ways that they could make those services sustainable and useful in our system. So whether it's looking at, are there one-time costs to get it started up, like that could make it more sustainable, or if there are measures that we can use to demonstrate how to improve this service, we want to be able to capture that. And so that's looking at utilizing that money again during fiscal year 24, so that we can have some time to really look at like what can be done and what those outcomes can look like for people. So those have gone to our Social Services Appropriations Subcommittee. They've done their prioritizations, and the next step is that all of the subcommittees submit their budget recommendations to the Executive Appropriations Committee, who will then prioritize across the entire system. So as we continue to follow the session, when we get to the end and we know what those results are, we'll make sure we capture that in an email and share that with you so that you know what the final outcome is. We often hear from families who are interested in advocating with the legislature. There are some advocacy organizations out there who are well organized, engaged in advocating. They have meetings with legislators. So these are the Utah Parent Center, the Utah Developmental Disabilities Council, and the Legislative Coalition for People with Disabilities. And we'll go ahead and get that contact information in the chat so that you can, if you're interested, you can access those and work with those agencies. Now I'll go ahead and turn some time over to Joseph. He's with Medicaid, and he'll go over the Medicaid unwinding.
Thanks, Angie, and good evening, everybody. Here to share some hopefully timely information with you all this evening about what is happening surrounding Medicaid unwinding, and perhaps providing some background information on what unwinding is and some of the pieces that have been in place since the start of the COVID-19 public health emergency. Apologies if some of you have heard this information before. I think we're trying to cover the background and getting caught up to where we are today. But at the start of the public health emergency in March of 2020, there was obviously a large response from the federal government as part of what we were doing. And one of the items that we did within Medicaid was to ensure that there wasn't an interruption to individuals and families' health coverage. So for those that were enrolled in Medicaid at that time, Medicaid enrollment has stayed in place for those members. So across the last roughly 3 years, we've not disenrolled members from Medicaid other than at their election, or perhaps if they have left the state. But otherwise, we've kept everybody on Medicaid since the start of the COVID-19 public health emergency. So as a result, we've had our Medicaid rolls increase by approximately 64%, which is third highest in the country. And now Utah Medicaid has more than 509,000 members at this point. With some legislation that Congress passed at the end of last year, there was a portion that separated the public health emergency provisions from this continuous enrollment policy. So I think many of you have perhaps been watching the news. The federal public health emergency is still in place, but beginning April 1st of this year, we will be unwinding this Medicaid continuous enrollment policy. So we keep using this term unwinding as the process that we're using, where across the next 12-month period, so starting in March, so in a couple weeks' time, we will begin reassessing all of the cases and all of the individuals who have been receiving Medicaid. So as I mentioned, roughly 510,000 members will be looked at across the next 12-month period. And we'll be taking a look based on their assigned review month in order to determine if they continue to meet the qualifying factors for Medicaid. I guess for pieces for you to be aware of, Medicaid services can still continue to be accessed as normal until the review process is completed with our partners at the Department of Workforce Services. So DWS will, again, need to review Medicaid eligibility. There's no need to take any action until you receive the review papers or the review information in your email at that point. Beginning on February 11th, you'll be able to actually see that review date in my case. I don't know how many of you have used the online portal with the Department of Workforce Services, but that information will be available online so that you can see when that month is upcoming. So kind of the pieces for you to be aware of, or maybe our call to action to you, first and foremost is to keep your contact information current. So across the last 3 years that you may have had a number of changes, a lot of people have moved, and it's obviously very critical for us to ensure that we're getting paperwork and information to the right address. So if you've had a change in your physical address, your phone number, your email, asking you to contact either the Department of Workforce Services or Health and Human Services, one of our health program representatives at the numbers that are on the slide there, and just let us know about those changes so we can get your information updated correctly. And then on the back end of that is to make sure that you're watching your mailbox, your email, for any information coming from DWS with respect to completing your review. So when you do receive those, you should normally get approximately 45 to 60 days ahead of when your benefit period or your child's benefit period will end. And important then to kind of complete that information as quickly as possible in case there's a need to collect other information from you. I think many of you may have experience in the past with providing bank statements and other information that DWS requires in order to make their determinations. That may happen here as well if they need income information like check stubs. So please make sure that you're responsive to those requests for information so that we can ensure there aren't any interruptions to coverage. Let's see. We've been trying to share this information with as many providers and partners that we can, including the support coordination groups, and trying to have them also keep an eye out and help families as those reviews become due. We also have information on the Medicaid website that discusses our efforts with unwinding that you're able to monitor progress on. And then we're also trying to provide this information in English and in Spanish where we're able to for this what we're calling the unwinding toolkit. So again, the biggest thing that we can reinforce is again, please ensure that your contact information with us is up to date so that we can keep eligible individuals covered. We're not interrupting coverage. For individuals where we do complete the assessment and we determine that they're no longer eligible for Medicaid for any reason other than the review was not completed, we will provide information, or we will be sending case information directly to the federal health insurance marketplace. So we will do that on your behalf or for individuals who will be losing Medicaid coverage. The loss of Medicaid or CHIP coverage is considered a qualifying life event, which will allow you to select a marketplace plan at that time outside of the traditional open enrollment periods. So there's information as well on this slide surrounding how you can find more information at healthcare.gov or the marketplace direct line. For most of the individuals that have been receiving waiver eligibility or have been enrolled in one of the waiver programs, we don't suspect that too many will lose coverage in this way, but just know that we will seek to try to find available health insurance for you should that determination be made. And just maybe again reinforcing the need to contact DWS, DHHS with any changes that you have for us. Thank you.
Thank you, Joseph. And I saw that questions came in, just so you know, we're capturing those. And once we get through the agenda, we're going to have some open time for those questions and answers. So we'll be getting to those. I now want to just turn some time over to Trish Jones-Parkin. She's with Utah State University, and we'll be talking about customized employment She has a ton of experience in our field. She's been engaged in employment for a very long time, has worked with other states, has done a lot of work in our own state in helping to get like training and resources and consultation to providers in our state to really help enhance services for people with disabilities and really make sure we're doing our best service, right? And so she's worked for DSPD. She now works at Utah State. She's someone who I've worked with directly for a long time, and I just adore. She's fantastic. So I'm going to turn some time over to her.
Thank you so much for that kind introduction, Angie, and good to be with everyone tonight. I am excited to talk about customized employment, and wherever you are, whether you're on the waiting list or your child is receiving services, whether your child is, of working age, so around 14, 16, kind of thinking about work, or younger, I think just kind of understanding what tools and strategies and what is possible. It's never too early or too late to learn about around those things. We had a question earlier today about, what does it look like for people in terms of working age and when they retire. And, I just shared that I helped a gentleman get his first job at the age of 50. And so it really just, it depends on the person and what they want and exposures and experiences. So Amy Langoni is here with me tonight from Vocational Rehabilitation. And we partner with both DSPD and Voc Rehab a lot. When we have had the opportunity to spend time in other states or go to conferences, and we share all of the kind of collaboration and the way that we kind of tier training, states are often looking to us and asking, how do we do this? How do we replicate it? And so I'm just really proud to work in Utah and with all the fine folks here. So Amy, if you want to go ahead and share the PowerPoint, we'll go ahead and get started. Thank you so much.
Were you guys seeing it when I put it up or no?
Get started, yes.
Okay, I'll put it back up.
Okay.
I'm on one screen tonight, so I'm trying to toggle back and forth.
Okay. Because right now we're seeing like everyone's pictures. So we're not seeing the presentation yet.
It was on for a minute and then it went to, it looks like, what is your whole screen?
I think you, oh, there you go.
There we go. I had issues earlier, so I just asked Amy to just help me avoid all of that. So.
So Amy, we can see it, but you're not in, like, it looks like you're ready to click slideshow, which is probably where we want to be.
Perfect. So, and we can start here. This is just fine. So at the beginning of the slides just has mine and Amy's contact information. I'm also happy to put that in the chat. I love this quote by Jack Kinder, and I think it really just outlines what we're going to be talking about in that, high achievement always takes place in the framework of high expectations. And as I talk about just the values and underlying principles of customized employment, that's really what the framework is of customized employment, that we presume competence. We're not excluding everyone. We genuinely believe that everyone can work with the right supports, and discovery is a wonderful tool in how we go about that, and then the strategies that we use. Next slide. So customized employment is a service that is available to people who are either connected to Voc Rehab or to DSPD. Typically, Voc Rehab is the first funder of services, and it's available through an employment service provider. That can either be called a community rehabilitation provider or program, is what Voc Rehab refers to providers as, or a service provider like DSPD calls them. And so they're funded through those agencies, and it really is just a strategy to help people find jobs that match their interests, skills, and then conditions of employment. But we also look at how we meet the needs of the employer. So we're not just looking at who is hiring and then trying to place people in those positions. We're really spending time getting to know somebody and understand what they're good at, what they do well, what they might want to learn about, and then really kind of using their social network and also growing that if that's something that really is going to help, grow those opportunities. We try to look for growth or opportunities around career growth, just like anybody else does in their careers. I'm assuming that no one on this call tonight is in the first job that they had when they started working. So thinking about career opportunities for people, regardless of the severe impact of disability, just like we do for ourselves. So looking for places where there's growth and opportunity, even if it is somebody's first job, and how we can get somebody's foot in the door and then negotiate some of those learning opportunities. And I have lots of examples of how we negotiated those in. So it really is an individualized approach to employment planning and then job development. And we do this one person at a time, one job at a time. So right there, we hear lots of, or not lots, but there are examples of, coffee shops or places where, groups of people are working, and those are perfectly fine. That's just not what customized employment is. It's one person, one job. Next slide. So the difference around customized employment is that we're using this specific set of techniques and strategies. And so because of that, we require employment specialists or people who are offering this service to go through specialized training. So the training right now that people are going through is a combination of 40 hours of coursework and then 40 hours of applied, going through the process, completing discovery with somebody, and that is the course. So everybody goes through with a job seeker in order to complete the course that we're offering right now with a lot of intense mentoring and learning all of these ways of implementing the service and writing and taking photos and creating a visual resume. So we'll talk about all of those, but it's based on the fundamental elements of supported employment, in that it was designed or developed to work with people who have the most significant barriers to employment, who people said could not work or had some of those unemployable labels in both the mental health field and people with intellectual and developmental disabilities. So customized is not better than other approaches, but there are some differences that, can make it a better option for people. When, somebody has kind of gone through some of these traditional approaches or not been successful, it's really nice to know that there are some other options or ways in which we can get to know someone. And we've had some good success with that. We've used some of these principles and taught discovery in transition classrooms with educators. We've done some work with families. So we're really trying hard to help people understand that there are different ways in which we can go about thinking about work and how somebody can be at their best. Next slide. So these are the beliefs around customized employment, that everybody has personal genius and we come from a place of abundance. So we believe that everyone has a story to tell in some way. So whether someone has, not a lot of verbal language, but tells story, has a story in other ways, behaviors, communication, all of those things. We believe that people are the experts of their own lives. We really rely on, the power of families and friends and community. And when somebody has maybe been isolated or doesn't have a lot of those things, we try to figure out, how can we build that? How can we develop supports and build relationships based on common interests, not just on disability specific kinds of things? So there's a lot of subtlety and nuance that goes into what it looks like for each person. If discovery looks the same for every person, that's not discovery, right? It's very individualized, it's very person-centered. We also believe that, somebody's skills are not static, and that people can learn lifelong, just like we all do, if we give people those opportunities and exposures to things. We also, in terms of that abundance mindset, there are unlimited ways to make a living in the world. If you think about, I would say almost every day I learn about somebody doing a job that I had no idea that existed, whether it's self-employment or contracted to do something, or just simply a job that I didn't know existed. And this also goes for being opportunities within communities of all sizes. So if it doesn't exist, then we can create something that everybody can use, right? So this is where the notion of supported self-employment comes in, or resource ownership. And we don't have time to get into all of those things, but that's really the concept, is that if it doesn't exist, how can we create it, and what is the demand for that? We also we want there to be some sense of urgency. That someday is too long, and that never is not an option. So, thinking about people who have maybe spent a lifetime in, segregated services, treating that next step with a sense of urgency. We also, I think this is something that's really, really important, is that power of reciprocity. And this goes to that social capital element, not just that you have a lot of people in your network, but that you are a contributing member, and that there's give and take, right? That you are also giving to your circle, giving back, all of those kinds of things, and making sure people have those opportunities. Next slide. So again, I kind of talked about this initially, that we aren't looking at the labor market and who's hiring, because when we're able to connect a person with the business and determine unmet business needs and make a good match, businesses are always hiring. And so we really try hard to base it on the skills, strengths, and needs of the person. And that becomes the foundation for creating employment outcomes. We're creating employment. We're not necessarily looking at who's hiring. And so, there's this economic development foundation piece of it. So, we're looking at what makes sense for the person, the job seeker, but then also what meets the needs of the community, if that's self-employment, and then what meets the needs of the business. So these employment specialists need to have an understanding of what unmet business needs are, and being able to speak that language. We use informational interviews where we get advice from experts in the field. We're not running around asking for jobs right away. There's just some different strategies that we use to go about this process. Next slide. So our values are very person-centered. Lisa talked about how important it is for people to understand their role, and how those person-centered processes are so important. Discovery is very much a deep dive into what makes sense for somebody around employment, where they're at their best, what kind of supervision makes sense for them, what kind of tasks, culture, all of those kinds of things are what we're looking at. Time of day. We look at choice, self-determination, and empowerment. We presume competence. I can tell you, in my experience, it is far more damaging to presume people incompetent than it is to presume overcompetence. And I still always presume that people are competent. And it just makes sense. We are about social inclusion, so looking for those opportunities where people will be included in their workplace and in the culture of that workforce. And again, we're not excluding everybody or excluding anyone from the opportunity to go through the discovery process and think about what's possible for employment. Everything is done in the community, in the person's home, and we're trying to really relate to what these person's experiences are, build on those, and then looking at competitive integrated employment. Next slide. So I just wanted to share this story, a quick success story about Abby, and we have lots of stories from around the state. And Abby gave me her permission to share this, and so did Mary Ellen, the employment specialist that we worked with. Abby was in her last year of post-high, and she had done several work-based learning experiences and was connected with vocational rehabilitation. She also is receiving DSPD services and has good family support. Her grandmother was really involved in her life, and so she lives in an apartment with roommates her age, and she was doing some day services in addition to the post-high program. And then Mary was helping her with this employment piece. And Mary was not as familiar with the DSPD side of things. And so we really spent a lot of time coordinating who was going to do what, and what was this going to look like when she exited school, and how is this going to relate to day services. And you know, she was starting out with not a lot of hours of employment, but wanted to build up to that. How did we make sure everybody knew that that was important to her, so that she didn't just have these limited hours to start with, and made sure everybody was on the same page? So we scheduled employment planning meetings every month until the discovery process was done, and we kept everybody on the same page. And when we held her customized employment planning meeting and shared her visual resume and all of the great things that she was doing, and came up with the list of 20 and all the things that we do during the process, everybody was so supportive and so excited about what was next for Abby. And within just a few weeks, a customized job was developed at the specialty market, where she is incorporating her vocational themes of beauty, customer service, and organization. So she does all of the kind of the beauty products. She works in helping to set up all of the seasonal kinds of things around organization. And then she does some customer service in their little specialty coffee shop. So this built on some of the experiences that she had in post-high, but then it really, we negotiated and created this position for her. And so just really all of the things worked so well. And so I wanted to share that experience because there were so many people involved. And I've had experiences where it's gone the other way and people weren't on the same page, and things got messy. And so again, when people communicate and collaborate, and we shared this powerful discovery experience, and Abby was so excited about it. They're really, we really worked through those issues. Next slide. I wanted to share a little bit about what the timelines look like. And I don't expect you to know what all of these stages or pieces look like. I'm happy to share anything else if anybody wants to reach out and share as much as you would like. But it really, can take, from 12 to 14, sometimes 16 weeks. It really just depends. Sometimes activities might take a little bit longer. You might spend a little bit more time doing informational interviews. But really, there's so much job development and foundational work happening during discovery process. At that time, when we meet at the customized employment planning meeting, we're coming up with 60 places. So 20 places for each vocational theme for this person, where we think it makes sense to consider job development. So while we don't start job development during this process, we have a really, really strong foundation. And then the customized job development process must be connected to the work that's done in discovery in order for it to be considered customized. So again, this is a lot of information that I'm cramming into these few minutes, but I wanted to just give you a taste of, if you're feeling discouraged or you don't have an idea of what's possible for your child, whether that's an adult or a young person, there are a lot of different strategies or ways to go about thinking about employment that are different than the traditional jobs that you might think of. It doesn't have to be 40 hours a week. It doesn't have to be 8 to 5. So just, keep your mind open and, think about those possibilities. So So typically, if you're going to have somebody help you with this process, you would apply for vocational rehabilitation services, go through the different steps of eligibility, and then you would connect with a provider. A CRP is the term, who specializes in providing customized employment services. You would need to work with a provider. If that's not something that you're ready to do, or you want to maybe just kind of try it out yourself as a family, or your son or daughter, your child wants to maybe do it a little bit on their own, or you're just curious, we do have a project that is funded through IOTI, that stands for Interagency Outreach Training Initiative. And we're doing some group guided discovery with students and their families. We've been doing this at the local independent living centers, and some post-high school programs have invited us to come in. Kelly Hess, who is my colleague, has been facilitating those groups. We've just started them this year, and we're excited about it. So you kind of go through these sessions, we have workbooks, and you kind of walk away with a profile that will guide you around what it might look like to think about employment and through a customized way. So again, you wouldn't be connecting with a provider, but it gives you a really good blueprint of what might make sense for you in terms of employment. That is all I have. Amy, I don't know if there's anything that you want to add in terms of just anyway, and we can look at the specific questions that people might have, but I was like a fire hose. I apologize.
I'm ready for questions too. So I don't think I have anything to add either, but you're always so thorough. So I appreciate that. And I love the success stories. They're always so great to hear. And especially that team approach with the CRP and the, of course, our job seeker. And those are always fun. Trisha's doing a really great job of trying to build our capacity in Utah. So we're trying to train more and more employment specialists to become versed in this model. So it is growing, and we're trying to bring it to all parts of our state. So that's been really fun to see also the growth.
Thank you so much, Trish and Amy. I don't see any questions for you guys yet, but as they come in, we'll make sure we send them your way to answer. We do have several questions that we'll go ahead and start responding to that have come in. The first question we have is, when you are assigned a new caseworker, is it their job to inform you? Are they supposed to reach out to you? Because that never happens for me. So I'm going to go ahead and have Jamie Douglas respond to this.
Hello. Pardon me, of course I get a frog in my throat. Waiting list caseworkers typically send out an email to individuals or families with their contact information when there's a change. But I think it's important to remember that each caseworker has about 600 to 700 cases. So sometimes it takes a little bit. If we're changing staff and we're reassigning cases, it can get a little bit confusing. So we certainly want people to know who their caseworker is. You can always reach out to the intake line, and I'll put that in the chat. And there's a DSPD info email that you can also reach out to, and we can help connect you with your waiting list worker.
Thank you, Jamie. The next question is, what do you do when your child is not going to be allowed at school because of their aggressive behaviors? So I'd say the first thing that you want to do is work with that school district. Parents have also reached out to the Utah Parent Center to have them help work with the school, to help them understand their rights under IDEA, and to have support with their individual education plan. The Utah Parent Center has a parent representative in each school district who helps parents with these things. When someone is in services with DSPD and has a period when they're unable to attend school, you would work with your support coordinator to see what services you could get in place to support your child during that time. This is an area that needs to be looked at carefully, because one thing we have to be careful not to do is to substitute or supplant educational services. Joseph, I don't know if you have anything you would add from the Medicaid expertise.
Hi, no, nothing additional that I would add from our perspective.
Okay, thanks. I just don't want to give, I want to make sure I'm on track with information. Our next question is, can you get ABA services while still on the waiting list? I'll go ahead and send that to Jamie Douglas again.
Hello. So yes, you can work with your private insurance or Medicaid to look for those ABA services. We've got a link that'll be posted in the chat that will help you find an ABA provider. And then I do have another list that kind of goes over different insurance, private insurance agencies that work with certain providers. So that might be helpful. DSPD doesn't actually offer ABA therapy. It is a service through Medicaid or private insurance only.
Thank you, Jamie. Our next question is, what about the waiting list? Why are we not requesting to do away completely with the waiting list? That is really a great question. Our department and our legislative committee have really been looking at, like, what would that look like and how could that look to eliminate the waiting list? There are a couple of reasons. One is planning around costs and being able to, like, understand and manage those costs and make sure we have those resources in our state. The other one is also making sure we have capacity, we have the ability in our system to serve people. So we have a waiting list of about 4,500 people right now. If we were to say we won't have a waiting list, we don't have enough services to meet the needs of those 4,500 people. So we'd need to have planning around that as well, something transitional. So things that we have done is in 2018, at the request of our legislative committee, the Social Services Appropriations Subcommittee, we completed a waiting list strategy report that was looking at, like, what would it look like to, like, what would the costs be? What are service options? How have other states tackled the waiting list? So we put that into a summary and report for our legislative committee to have as they're considering, like, how to manage the waiting list and what does that look like for us. Also, we have continued to review what are other states doing, who does and doesn't have a waiting list, how did they get there. So we have what's called a strategy report advisory committee who is looking at part of that, as looking at some of this stuff as part of our response to our settlement. So we continue to look at these things. Representative Ward has a bill currently out that is looking at what it would take to fund up to 200 people every year from the waiting list. And while I know that probably doesn't sound like, it may not sound as encouraging as you would hope, it really is the first time a proposal has been considered to assure there is some kind of funding every year for the waiting list. And during the interim, our Social Services Appropriations Subcommittee has really been looking at, like, what does it take? Like, what are the needs? What does the waiting list? Trying to understand the demographics, how long people are waiting, what are they needing? Our team has put together like a waiting list calculator that helps them and allows them to be able to put in numbers and figure out, like, if we did this, what would that cost? What could that look like? What are our options? So people are vested in meeting the needs of people in Utah. So that I hope that gives you an overview of kind of what goes into that. Our next question is, what are we doing about the Medicaid waiting list for diagnoses? The needs can't be addressed without this, and yet it is hard to get. So Jamie Douglas, I was hoping you could help us with that answer.
Yeah, I'm gonna read off what we have and then ask for clarification if it's totally off base, because I'm not exactly sure I understand. But if you're applying for services through DSPD, you can work with your intake worker, and we can help get a new psychological evaluation that can help with the diagnostic portion. But I'm not sure if you're asking about Medicaid specifically, like if you're trying to get on disability Medicaid and you're waiting for an evaluation, or through Social Security. I'm not really sure. So if I missed what you were trying to ask, if you could either unmute yourself or put something in the chat, that would be great.
Okay, if you do have a question later, please bring it up. Our next question is for Joseph. The question is, will there be sufficient staffing at DWS to address the need to re-qualify people? How will the review month be communicated?
Yeah, thanks, Angie. And the short answer is, I think we will see very shortly kind of how the capacity is there. I think we're talking about a volume of reviews that DWS has traditionally not had to do in a given month. It's obviously a very high number. I mentioned approximately 509,000 Medicaid members currently. I think they're estimating as a result about 30,000 to 35,000 reviews each month. Obviously a pretty staggering number. But yeah, the short answer is I'm not sure we know, and that's where we'll continue to provide updates in the unwinding site that we've developed on the Medicaid page. And then certainly we'll come back to forums such as this and then provide updates through email to provide information on how things are going. With respect to the review month and how that's communicated, so I mentioned within my case, beginning in a few days on February 11th, you'll be able to see which review month you or your family member is slated for. If you haven't necessarily set up my case quite yet, that information may not be available. But again, following, and then for those that were involved in Medicaid prior to the public health emergency, you normally see your review forms, and those could either be sent through mail or through email about 45 to 60 days before benefits end. So there is a little bit of a window before that happens. So again, it will either go to the physical address that's on file, or an email address you may have provided if you selected electronic only correspondence.
Thanks, Joseph. I think the next few questions are for you. So just the next one is, what should someone do if there is no info in my case and you don't get an email?
Yeah, apologies. I kind of jumped ahead on that in the last response, but
no,
that's my fault. But if my case isn't set up, or you haven't engaged with that system quite yet, any information surrounding your review will go through the mail service. You'll receive that by physical mail instead.
Okay, the next one, still for you, is, what does directly transferred mean, and what will that process be?
Yeah, so going back a little bit more to information surrounding the loss of eligibility and our interaction with the federal marketplace, healthcare.gov, and the federal exchange. But again, if the Department of Workforce Services determines that an individual or family is no longer eligible for Medicaid, we have an electronic interface that we have set up with our federal partners that will send the information to the exchange and let them know to evaluate for possible plans and coverage. They will reach out to you then at that point with any information for plans for you to consider if you're eligible, perhaps for some of the subsidies that they offer through the exchange.
Okay, and one more. Did you mention that changes can make someone lose coverage?
That's correct. Yeah. As part of the continuous eligibility that we've been doing since 2020, this hasn't come into play, but Medicaid does have very specific criteria in order to qualify for programs. So this includes everything from citizenship to income, assets, possibly other factors such as disability or relevant maybe to this group, eligibility for one of the home and community-based waiver programs. So it is possible that if one of these factors change, that it may affect eligibility for a program or possibly Medicaid coverage in general.
Okay, thank you. Our next question is, how long is the current wait list averaging to get services? Is there a contact to see how long it could be for an individual? Jamie Douglas, do you want to take that one?
Sure. So currently our wait list is around 4,500. You're always welcome to call your waitlist worker, and we can put that number in again for you so that you can talk to them about your current number. You're also always welcome to update your needs assessment, which will adjust that waiting list score if there are changes to it. So that is something that you can do. I think it's pretty hard for us to give an estimate of time that people will be waiting for services on our wait list right now, but we could definitely talk to you about your current situation.
Thank you, Jamie. I would just echo that we do have averages that we'll share, but they're a little bit misleading because it really can vary. Someone could be on the waiting list for less than a week based on the kind of urgent emergency circumstances that they're in. And we have people who have been on the waiting list for over 20 years. So if you look at those, right, if you hear the average is something, it really is based on most critical need. And so the average is kind of a hard way to measure any kind of expectation. So thank you, Jamie. The next question is, can you move to another state to get services if you are on the waiting list, if needs are immediate and the waiting list is unhopeful? So you would want to contact the state that you're interested in moving to. I'm pretty sure that, right, you need to have residency in any state when accessing Medicaid services in that state. And you'd want to understand what the scope of their services are and what the eligibility criteria are. Each state has the ability to establish those. And for some states, they're a little more stringent, and other states, they may be a little bit broader. There are states that do not have a waiting list, but again, you'd want to understand like what services are available, would it meet the needs that you're seeking? So you'd really just want to make sure that you get informed up front, right, so that you know what you're walking into. I don't know if Jamie or Joseph, you would have anything to add to that. Okay. Our next question is, how does my daughter move from 150 on the wait list to 750 when her needs have increased? I think that is a really good question, and I can understand where that comes from. Jamie, if you want to jump in and answer it, go ahead, and then I can just add anything if you want.
Sure. So I think in order for us to be able to give you accurate information, we would need to look at your case specifically and look at the needs assessment questionnaire, which I'm happy to do. I'll put my information in the chat so you can reach out and we can take a look at those things and I can answer questions. The waiting list rankings are pretty fluid and they do move around as new people come onto the list, as people's needs are updated. So it really can depend, and it's hard to give kind of a general example. So I'm happy to go over anything with anyone so we can make sure that our needs assessment is correct and your current ranking is correct.
Thank you, Jamie. And I would just echo it really can be fluid as we continue to have people enter the waiting list, as we continue to have information updated based on people's current circumstances. I do want to just put out there, I know that primarily we bring people into services based on the most critical need. But a few years ago, we had a waiver approved that's referred to as the limited supports waiver. And this is actually kind of the opposite of like having the most critical need. This waiver is really looking at how do we get into a home earlier, provide supports, and help kind of keep that family whole and stable. It's a smaller waiver. It has capitated costs. And it also has like limited services, but the services are really focused around like how to enhance those and strengthen the home environment and supports for that family home. In the case of the limited supports waiver, we're looking at like people who have a limited amount of needs. And then we also look at to understand like how to bring people in under that, how long someone has been waiting for services. So when people come off of the waiting list, people come off based on their most critical need, or if there is money designated for the limited supports waiver, which happened last year, right? 10% of the funding we received went specifically for the limited supports waiver. Then people come in through that avenue as well, just to make sure people know kind of what is out there and what is possible. Our next question is, where can I find more information and help for spousal caregivers? I have cared for my husband for 15 years with no support. Joseph, would you like to take that one?
Yeah, no problem, Angie. And I guess in short, our options for spousal caregiving are a little bit limited at this time. We talked earlier on in the discussion tonight that spousal caregiving is available through several of our Medicaid home and community-based waiver programs. This initially started with the public health emergency and was made permanent, not last year's session, but the session prior. And it remains a permanent flexibility in several of the waiver programs that serve adults. So that is now an available option for service delivery in each of those programs, but with the contingency or with the requirement that you have to be participating in one of those waivers in order to access it through Medicaid.
Thank you. Then we have, I think this next question is yours too.
Yeah.
If DWS finds out there isn't enough staffing to keep up with each month's requalifying workload, is there a contingency plan, like lengthening the unwinding period, or will people just be kicked off?
And the short answer, or at least the one to allay some fear, is that individuals will not just simply lose eligibility and removed from the program. We do have very specific regulatory requirements to ensure that due process is followed. That means the ability to appeal a decision and obviously the ability to complete your review. So the short answer is I think we will learn very quickly to see what type of contingency planning may be required. I think the example you mentioned, perhaps lengthening the period of our unwinding may become a legitimate requirement. And that's where we will, again, continue to come to places like this to provide you updates with what we're experiencing and use our Medicaid dashboard to share relevant information. So we will try to keep you informed as things progress and let you know of any changes to our plan.
Thanks, Joseph. We had a question that's, as we move forward with working on increasing rates for staff and respite workers, is or will there ever be an option to offer insurance for our staff? We can't compete to keep great workers. So I think if we're looking at our provider system, that's really a business model question. We have providers who are providing insurance for their staff. If we're looking at self-administered services, I think that is a good question for us to look into, like what options are there under self-administered services? The way it is set up right now, that it does have like the workman's comp included, but it does not. So I think that's a question that we'll have to look into. So thank you for elevating that. This next question, Jamie, I'm wondering if you're ready for it. It's what are typical critical needs that would move someone up on the wait list? And I think it might be helpful to help people know how the needs assessment was even developed.
Sure. I think I'm going to talk a little bit about the scoring and the percentages, and maybe that might help answer some questions. I mean, there's a lot of different reasons why somebody's needs would change, and it can be in a lot of different categories. So the needs assessment questionnaire that was developed by third-party researchers, it does allow us to look at kind of the whole picture, right? So severity of need is one of the main categories, which looks at personal care needs, daily living needs, personal safety, behavioral issues, and specific medical needs. So that section is typically 50% of the overall score. Caregiver support, which is availability and ability of the family and caregiver, that is 30% of the overall score. And then time on the waiting list is 20%. So it actually calculates every day that somebody is waiting. So that's kind of how those sections work together. Critical needs could be anything, could be behavior, it could be a medical need, it could be loss of a caregiver, it could be homelessness. There are lots of different reasons why people's scores change and different critical needs within that actual scope of that assessment.
Jamie, would it be fair to say too that as we contracted to have the needs assessment developed, they surveyed everyone on the waiting list at the time, right? And they held multiple family meetings to get their feedback on like what is most critical, how does this impact that? So as they developed this, it was responsive and reflective of what families were identifying as the great impactors. Is that an accurate representation? Or
it is, yeah. And I mean, more weight was put on physical health, time on the waiting list, caregiver support because of those focus groups, because of the feedback we did receive. So we did add a lot of information to that needs assessment questionnaire to kind of look at the whole picture.
Thank you. The next question is, with the limited supports waiver, does it term limit? Like, do you get limited support forever? As long as the person is around to receive it, or just for a few months? And Joseph, it looks like you are ready for that question.
Sure. And I guess the short answer is when we're talking about limited support on the program, it's not necessarily to do with the amount of time, but more so the amount of services that are accessible to the individual and their family in a given year. There's no immediate limit to when that ends. Certainly, we have a responsibility to ensure that the waiver can safely meet an individual's need, but there's not a time limit.
Thank you. Okay, so we have a question. Do you have to sign up for the limited supports waiver, or if you are on the community supports waiver waiting list, then you are considered for the limited supports waiver? Yes, you got that correctly. So we have a single waiting list. And then when we're pulling people off of the waiting list into services, we use the criteria and based and the funding that we receive to determine that. So if you are on the waiting list, you are already there. Just give you a minute in case there were any questions out there being typed in. Also, feel free to raise your hand.
Yeah, and I think Angie, Rochelle had kind of mentioned some of the information or had elaborated further on kind of the diagnostic question that she had previously. And my best suggestion would be to reach out to one of the enrolled Medicaid ABA providers. We shared the link earlier during the meeting. I'll add it here again. A lot of them are often very well connected with or can perform some of the diagnostic or testing that may be needed. And if your child is already qualified for Medicaid, that shouldn't be a concern for them. I'll also leave my email in chat as well if you're experiencing any issues, and I can work with our policy team to get you some answers or resources if you're having difficulty with the testing side.
Thank you for catching that, Joseph. I had missed that, so thank you. So it looks like those were the questions for this evening. I just want to say thank you so much for coming. Our next self-advocate and family gathering will be on Wednesday, May 10th. And as a reminder, you can find information about past and upcoming family meetings on the DSPD website under the Individuals and Families tab, and then under the Be Informed and Be Involved heading. We'll be putting information in the chat about different public meetings that we have, such as our Disability Advisory Council, as well as where to find material. So we'll be putting that in the chat for anyone who is interested. And just thank you again so much for your time, and have a wonderful evening.